Good evening, everyone, and thank you for joining us this evening for our cattle and sheep vaccination webinar. I know we're coming up on vaccination season, and each year we try to get it right and make it better, and there are a lot of vaccines to choose from, which vaccine is better for our cows and sheep and so forth. So I'm going to go ahead and introduce myself. My name is Jessie Jim, and I am the field coordinator for the Navajo Sustainable Agriculture Project. And I'm going to introduce.
I want to thank Jessie and her group again for the invitation to participate in this program, providing education the best way we can. And they'd asked me to visit with you guys tonight. I put livestock in there to kind of collectively talk about cattle, sheep. I go into goats a little bit, but sheep and goats are pretty interchangeable. But the idea is that establishing a vaccine program is really going to set your animals up from birth on to weaning. And so that's kind of what we're going to talk about. And excuse me, I've been sucking a lot of dust. I don't know about you guys, but it's been quite windy here. So anyway, all right. Okay, so health really starts at birth for all animals in the form of colostrum. It's that first milk. And it's not only is it very nutrient dense, but it also contains what are called immunoglobulins. It's kind of a tongue twister, but it is the basis foundation for introducing immunity to the animal system. The challenge with these IgGs is they have to be ingested within the first 24 hours of life, and I'll show you a graph as to why that is. And then if by chance, for whatever reason, these animals don't receive colostrum, it's very challenging for them to go on and be healthy for one, but even to survive. It's a little bit of a death sentence, unfortunately, if animals don't receive adequate colostrum. Something that's been well documented through research is the dam's nutrition prior to calving or lambing is directly correlated with colostrum, not only content, concentration and quality, but total quantity as well. So if you have thin animals, whether it be at lambing or at calving, chances are the colostrum they're producing really isn't what that calf or lamb really needs. So why such a short window of time? So the proteins, these IgGs are protein structures that are very large. And in order for the animal to absorb them, they have to have sort of a porous gut. So a lot of big openings so they can be passively absorbed into the system. But at the same time, that's kind of a dangerous window for pathogens or potential disease-causing agents to get absorbed as well. So as soon as that animal hits the ground, that window starts to close, if you will. Those pores start to close. So really the ideal time is only 12 hours, but you still can get some absorption of colostrum. Say you don't find that animal until he's slicked off and standing up, but you don't know for how long that animal's been born. You still have a little bit of time to get at least some colostrum into their system. So what happens is through vaccination, you can boost the animal's immunity in utero to the fetus, but it starts to go down. So basically by birth, they don't really have much immune system to speak of. They're very vulnerable. And that's where colostrum kicks in. That's this black bar here. But over time, even its function starts to wane and decline to the point that it's really not offering enough protection if that animal is exposed to certain diseases. And so this crosshair here indicates kind of where a vaccine would kick in and help boost that animal's immunity. So if vaccination is not part of the program, what happens is the immunity sort of plateaus in the animal system, and then any sort of introduction to disease, once it's hit that plateau, really leaves that animal vulnerable to disease. And so this is why vaccination programs are so key in any management system. So how do diseases work? We have two basic sources. We have what are called viral, and viruses are basically protein-based structures that do contain a DNA within it. And they are usually in a confinement situation. It's due to nose-to-nose contact or direct contact with an infected animal that it's transmitted. But out more in like open pastures where you can have viruses crop up is what's called bloodborne transfer, whether it be mosquitoes or flies. And then, so the birds could be on the manure side of things, but really these vectors are anything that exchanges blood between an infected animal and a non-infected animal, okay? And we've learned a lot about viral diseases with Corona, I'm sure. And we understand that these sicknesses or the virus really takes hold and external symptoms start to show about 7 to 10 days after exposure, okay? On another source of disease are what are called microbial diseases, predominantly caused by bacteria, but fungus and protozoas are also single cell organisms that can cause disease, though not as common. Trichomoniasis is a protozoal disease, okay, as an example. Anthrax is fungus, and then you've got your bacteria, whole host of bacteria. So basically what these guys do, they're fairly opportunistic, meaning the animal is first challenged with a viral disease. This is a pretty common scenario. And the body is taking all the effort to attack that viral antigen in the body and not really paying attention to these other microorganisms coming into the system to wreak havoc. And that's where you get that secondary pneumonia oftentimes, due to these microbial diseases. The other thing with some of these diseases, and we'll talk about kind of the vaccines to help protect, are they typically can be extremely fast acting, okay? Notoriously would be something like overeater's disease due to an enterotoxemia, tetanus, and blackleg. Okay, we think blackleg's eradicated, but in reality, it can rear its ugly head, and you see a healthy animal one day, and then you find a dead animal the next, and you don't know why. We actually had a scenario like that out at the bull test this year, just this last week. So this calf was 1,000 pounds roughly, no health issues. He's been on the facility for almost 100 days, well vaccinated, okay? And then he just came up dead in the pen, and the veterinarian had determined that he had likely died from enterotoxemia, or that overeater's disease. So you can have breakthrough infections for whatever reason, but these guys will infiltrate their systems pretty quickly. And it's usually through ingestion. So like this picture here, you can have some infected manure that's carrying the microbes, and then it's eaten by another animal in the grass. Can also happen aerosol, via aerosol or in the air, much like viruses can be. And then we often think about tetanus as an open wound infection, and that certainly is the case for that particular pathogen. And some of these guys live in the soil, right? Or a lot of these bacteria live in the soil. So if you've had a case of tetanus, you're not going to be able to ever eradicate tetanus in the soil. It's there, it's everywhere. So the best protection on some of these diseases is through vaccination. So I'm going to talk about this statement a lot because it is very important. And I do realize that for some folks, this is challenging to have direct contact with the veterinarian on a regular basis. But even if you can touch base with one once a year, it's really beneficial. So these folks are up to date on new products. They know if there's an outbreak of some kind going on or heading your way that needs some added protection. They can help you build a program to offset and protect your herd. And the benefit too is that they know your herd, they know your animals, they know your management style, and so they can do the best job in consulting you on those issues. So we're first going to visit about cattle. We really can't intertwine these animals too much, sheep and cattle, in terms of vaccines, because they are a bit different in terms of management and type. But always keep in mind that a good vaccine program on your beef cow herd results in healthier calves, right? That's our goal. And with that, you sell these animals, they do well in the feedlot, and they are healthy in the feedlot, they perform well because they're not getting sick. This builds you a reputation that draws buyers. And so that's a good way. That's just another added bonus to having a good vaccine program. And then the other thing to keep in mind too is you are investing in the health of your replacement heifers, establishing a really good immune system in those young females, at 3 months and on, will enhance their ability to stay in the herd longer, because we know that it's expensive to raise replacements. So if you're a buyer, getting back to the value of health, if he were to see 2 lots of cattle and he was to compare his risk on the A group over here versus the B group here, which one do you think he'd pay a little more for? The insurance policy is a little better on these calves, that they're likely not going to cause too many problems. They're clearly healthy and in good flesh, where these calves are looking a little rough, probably newly weaned, which is going to provide some challenges to his customer, meaning the feedlot. Okay, so I bring you back to this graph simply to show you that, now is the time to think about, we've taken hopefully care of the colostrum, and then through good nutrition, and you're certain that these animals have got adequate colostrum in their system, but now it's time to help them out. So the best time to do that is your first opportunity for most commonly in Western systems, Western US systems, is at branding. So the first time you're able to really put your hands on these calves is an opportunity to boost their immunity. And you're wanting to cover both the viral diseases and the bacterial or the microbial diseases. So viral protection, hands down, your best protection and added immunity for these calves is to provide what's called a modified live virus vaccine. And it's the ones you mix. I'll talk a little bit more detail of management of these modified lives. Here is an intranasal shot called Enforce, and then this one is Cattle Master Gold. We don't try and go into brand specific preference one over the other, but there gives you some options. So Enforce, like I said, is an intranasal. It covers everything but bovine viral diarrhea. Partly the reason that is because that particular virus, when you give the vaccine, can cause problems in pregnant cows. Okay, so this one has everything but BVD. This one is labeled safe for cows, but it does contain the BVD option as well. So again, this is where the veterinarian really can help you make those product choice decisions. So what is a modified live? It's basically a genetically altered, or in some cases, a chemically altered version of the actual live virus. And this is why you get a better response versus what's called a killed virus vaccine. So the challenge with these viruses, these vaccines, however, is they are all vaccines are sensitive to heat. You need to kind of keep a consistently cool environment for these vaccines. I'm struggling with getting those two words switched. But something too is they have a very short shelf life, if you will, once they're mixed. So this is where planning becomes really important, and how much, in the case of dosage per box that you buy, how many cattle you think you can do within a couple hours, and you piece that out accordingly. You only mix one bottle at a time. And so typically kind of what I do, if we've got 150 head to vaccinate, I might get 2 50-dose vaccines, feeling pretty comfortable we can get those done in a couple hours. But then I start to buy the smaller dose options, the 10s or 25 dose, depending on the product. These are single dose here. And the reason I do that is, you never know, right? You get either, you don't get all your cattle in that you hoped, or things just go south for whatever reason. And once these things are mixed, you can't just throw them in the fridge till the next day. They really do, their efficacy outside the animal only lasts about 2 to 3 hours, okay? So once it's mixed, you've committed to using that product. You can't reuse it after. If you have half a bottle left, it's not something you can reuse later. Also, the one caution with modified live vaccines is some are not safe to have around cattle, pregnant cows, because all vaccines on the modified live side, the animal that receives that vaccine actually sheds the virus, aerosol-wise. He'll breathe it out. He can expose the dam to that virus, and then she can ultimately, usually in the form of abortions, is what happens with certain products that aren't labeled safe for cows. So read your labels. Again, consult with your veterinarian on that. We have questions. I see chats. Let me make sure. PowerPoint. Yes, I will provide a PowerPoint. Okay. The presentations, if you have any questions, feel free to unmute. Yeah, that too. Okay. Just wanted to check all those chats really quick. Sorry. Okay. So the other vaccine you want in your program at branding, okay, you have your 5-way virals, and then you have what are called your 7 or 8-way products for your bacterials, your microbials, clostridials. They kind of equate to the same thing. And like I said, if you're not protecting your animals for this, it can be a very challenging disease to combat. Now, one thing I want to caution everybody, so 7-way or 8-way, you're covering a lot of diseases with this one shot. But one of the issues I see at sale barn sometimes is this is the only product that's given, and they tell their buyers that they've had all their shots. Well, it is a little bit confusing in some cases. Yes, you're covering 7 diseases in this case, but you're certainly not covering all the diseases. So you really need a combination of the modified live for the virus, the viral diseases, and this clostridial group of diseases as well, okay? So you see on some labels that in this case, Vision 7 with a spur. What a spur typically indicates is it's got an additional product or that it's going to, or disease that it'll protect against. In some cases, that would be tetanus. In this particular case, it's called Haemophilus. And most veterinarians do like in cattle programs that you have a Haemophilus spur. And so that's something to think about too. One of the nice things with these clostridial products is, well, 2 things. They can be used on both your sheep and your cattle, but they also, provided they've been handled appropriately, after they've been opened, meaning they didn't get too warm, they weren't exposed to a lot of sunlight. If you feel pretty comfortable that the product was handled appropriately, then you can put that back in the fridge and use for another date. So if you work your cattle and then you have plans to work your sheep or vice versa, you can continue to use the same product out of a single bottle. So you can buy those higher dose bottles to save money. So something to keep in mind that I think we take for granted sometimes is stress really reduces or can have a very negative impact on how well vaccines are absorbed in the body. And the reason that is stress reduced, or cortisol is a stress hormone that is released when an animal is under stress, okay? And what cortisol does is it can sometimes block the absorption of some vaccines, okay? So we wanna this is a very expensive portion of your operation, or can be. So we wanna make sure that we're fully protecting these animals and give them the best shot at success with the vaccines. So if you think about branding, you've pulled them from mom, you're crowding them when they're not used to being crowded, you're roping them or you're running them through a chute. There's a lot of noise. You're castrating, you're dehorning in some cases, the vaccination, and certainly heat can play a role and added to that stress as well. So I know branding is a very social event. Everybody comes out, wants to help. But in reality, if you can put together a really good crew of a handful of people, that benefits you, that benefits the animal, and you will get work done just as quickly, if in some cases not quicker, depending on your crew, with fewer people. The other thing to keep in mind is keep it quiet, work it slow, and with the right efficient crew, your time is not going to be, you're not going to get behind with doing what you need to get done that day. Facilities can actually add stress to an animal if they are not in good condition. If they can have injuries or that kind of thing, certainly is not great. So that's something to keep in mind. And you don't need to hot shot every calf every time through the chute. I've seen that done many times, and it's not really effective. If you're just standing in the right spot, all you really need to take is a step. You don't need to make a lot of noise or use a lot of tools to get done what you need to get done. If you ever have an opportunity, I recommend you checking out BQA videos on animal handling with Ron Gill and Kurt Pate. These guys really do a nice job explaining how to have a good work day and do it effectively. Okay, oops. Just checking the comments. So the next opportunity you're going to have your hand able to work your calves is at weaning, obviously. And this is actually probably more stressful time for these calves than branding. And this is where these calves are going to break with sickness simply due to the fact that in many situations, they are going to go to a confinement situation, which they're going to be increased exposure to foreign viruses and bacterial diseases, but also just the stress of confinement. So take the opportunity to go ahead and boost immunity at this point as well. And when you're setting these calves up with that second shot, or in some programs, you might keep them and background them for 45 days or so, then you might have 3 shots in your program. This really is going to help these guys perform well once they leave the ranch. Okay. At what age is weaning recommended? So that's a very good question. And the big answer is it depends, right? So most people are starting their calving right now. If they're a spring calving program, And really, there's no advantage to carry these calves beyond 7 months of age. You're not going to get that much more gain in that extra 30 days or so. If anything, it's putting more pressure on your resources and your cows, even though they're really not milking much at that point. So 6 months, if you're in a situation with drought, I know guys that get their calves to about 300 pounds and send them. So again, it's going to depend on your forage situation. But weaning can be a really good tool to manage that. So if, however, you are in a situation that you have to wean earlier than normal, this is where health gets really important, because these guys' immune system haven't had a chance to fully develop. So if, say, you're needing to wean at 350 pounds, give their booster at that time. And then if you can have a way to background those calves somehow, really make sure that they're through the stress of weaning before you ship them, you'll make your buyers much happier. Okay. So it just depends on your situation. Okay. So Stuart would like to chime in, and I know they run a fairly extensive weaning program with their operation that he can maybe give a perspective as a producer. So go ahead, Stuart.
Good evening. Can you guys hear me?
Yes, we can.
Yes, we can.
Okay. All right. Good evening, everybody. Hope everybody's doing fine. Just to add on to what Dr. Ward is talking about, we've at Cedillo Cattle Association here on the Pueblos Laguna, we have a pretty good VAC program as to how we give the bulls, our cow herd, and the calves their shots during branding and post weaning. We do use the modified live for branding on these calves. We go with the Covaxin 8, your Enforce 3, which is your intranasal, and with the multi-min is what we also give them. As far as the cows, when we run them through in May, we booster them with their Covaxin 8 and give them a modified live. I think it's Cattle Master 5 with your Vibrio Lepto, and it is safe. We've used it. It is safe on pregnant cows because we put the bulls in at that time. And then post weaning, what we've done a little different is we brand it probably a couple weeks earlier, and went ahead and given them their shots at that time. Booster them. Hi. Yeah. And then we also booster them with the different modified live. Is it with their one shot, and then we booster them with the same kind of Enforce 3, but with the injectable and with pill guard. The pink guy is what we use now. And then on our bulls, of course, we trick and fertility test them, give them their Covaxin, and that's about it on what we do with them.
Okay. All right. I'll appreciate that story. Yeah. So one of the things, and if memory serves, that they do is, do you do that 60-day weaning or 45-day weaning program?
Yeah, we usually do the 45 to 60-day weaning program. Put them out with, we feed them out with weaning pellets and feed them alfalfa or wheat. And then after about a week or two, then we'll just kick them back out into the pasture, and they'll be out on pasture, natural grass till whenever we bring them in for the buyer.
So one of the things that's a benefit in terms of health for the next step, meaning the feedlot or your stocker buyers, whoever you're marketing to, that seems to be a price break, pretty substantial price break difference for people. If they know these calves have been off mom for more than a month, at least 45 days, that's a much more attractive option for buyers than to just pull them off the cow and send them to town. And so that's something to think about in terms of your marketing program. And you can incorporate a third vaccination round. It would benefit you in that scenario to do so. Meaning, so say you wean, or say you bring them in, you give them a round of the second dose of your vaccines, and then you would put them back with mom for a couple, 3 weeks. And then when you're ready to fully wean, you would give them their third dose. And that would really help reduce the chances of them getting sick on you while you have them. And that's a pretty common practice if you have the facilities and labor to do so. I'm trying to think what the next slide is here to kind of feed into that. Yeah. So again, the benefit of the weaning is okay, you had a nice response on that first shot after branding. It starts to drop down again, but then by that second dose, it really adds a lot of added protection. And like Stuart said, don't forget the cows and bulls. You really want to incorporate a annual booster program for them as well. We've found probably the best advantage on the cow side is to vaccinate these girls with a viral vaccine and a clostridial both at, say, weaning. Okay, when you have them in the chute for preg checking, go ahead and hit them with their boosters for those products, because they can then transfer some of that immunity onto the fetus while she's still pregnant. So there's some added benefit there. For the bulls, you can maybe wait until you're doing your breed soundness exam to go ahead and give them their boosters at that time, since they're already in the chute. Now, again, I can't stress enough the value of using those modified live vaccines in the first 6 months of that animal's life, because you're keeping some heifers back likely, right? And you want her to have the best immunity that she possibly can have with the added bonus of vaccines, and setting her up that way can certainly do so, okay? And as far as worrying about modified lives being safe for cows, really, more and more products are fine to give to calves and turn them back with their pregnant cows, or give to pregnant cows directly. So just, again, read your labels and be sure that that's the case. So something I want to talk about too, and Stuart sort of referred to his program. We at NMSU have what's called a VAC verification program. And basically all this is a way of producers to give your buyers an added boost of confidence that your calves have in fact received XYZ vaccines. We've been doing this program for about 4 years now, and it seems to be very beneficial for producers that participate. They get a little boost in their cost of their price of their calves if they go through some sort of what's called a third party verification. And all that means is you are giving your buyers an opportunity to have a little bit of a guarantee as to what these calves have had. So let me stop share So this is our website, but I'm going to go to it for just a second so you can kind of see what the program I'm talking about is. Okay. All right. Okay, so this is our homepage. It's nmbeef.nmsu. Right now, whenever we have a major program, we host it on the main page. But here we have the calf program. And if you're interested, you can enroll by pushing on this button. Basically, all it asks is that you provide receipts of purchase of vaccines and dates of birth, the average start birth date of your calves and the last calf to hit the ground. And then you provide that information to your county agent, your tribal agent, something like that. Okay. And it gives you sort of information about vaccination programs and kind of what they look for vaccines as well. So I'll stop share that. And I'll go back to the presentation. Am I right there? Okay. Can you guys see that? Okay.
Yes.
So any questions before we move on to sheep? Stuart said he wanted to visit about his worming thing, but also if we have any questions, I would take them about cattle specific. I'm sure I left some things out. I hope not, but. Anyone? No? Okay. All right. We'll move into the sheep side of things. Now, the thing with sheep is they have different diseases. They have different stages of production, obviously, which means their vaccination programs are going to be timed a bit differently than cattle. But the reasons we do vaccinations for sheep and goats are the same, right? And just like with cattle, the condition, nutrient status, nutritional status of the dam can affect the colostrum quality and the total quantity. Hello?
Yeah. Okay. So I had a question about the cattle. Sorry, it's kind of like
okay.
I just thought about it.
Okay.
So when you vaccinate and all, it's best to do all at once. Well, depending on the program, of course. For the dehorning, is it best to do it during that time at the same time too? Since you have them in a pen and you have them kind of, I guess, controlled.
Yeah, that's a very good question. In our beef quality assurance trainings, we address that. But I can tell you the earlier you can castrate and dehorn, the better. Okay, so some people think, well, if we leave the testicles on till weaning, we're going to get a bunch of extra growth. And in reality, what happens is the older these calves get, both whether it be castrating or dehorning, it's more stressful and there's more blood loss, there's higher risk of complications. And so they end up going backwards, really. For anything you might have gained with added growth, you lose in the weeks following castrating or dehorning when they're older. So branding is the optimum time to do some of those procedures, just because the calves bounce back so much better, and they have time to heal before they're really stressed with weaning, if that makes sense. So
okay,
yeah,
right.
definitely.
Awesome. Thank you.
I have a good graphic because when they're calves, when they're like 2 to 3 months old, you'll have the buttons, and right then it's really just attached to skin. And so by the time they're 6 months old, bone is starting to incorporate into those horns in the form of their sinus cavity. And that's why there's so much more blood and nerve endings, and it's much more painful once it protrudes out of the skull by a couple inches. So really, yeah, branding is the best time.
Okay, sounds good. Thank you for that.
You bet. Any other questions? Okay. Okay. So again, vaccinating to prevent disease. Oh, yep. Go ahead.
I was just gonna say, did you say when you should brand your cattle? How soon?
So, ideally, this is probably a longer answer than you wanted. Ideally, you have a breeding season, right? So the youngest calves coming in, say your calving season is from March to May and you're branding in June. You really don't want to brand anything that's under 60 days if you can avoid it. Though their hide is so thin, you have a higher risk of going clear through the hide and having infections. And it's really hard on those little guys that have really thin hide. So ideally, if you're about 3 months out from calving, that seems to be a good time, you know, when they're about 150 pounds roughly. I think you've got a safe bet to go ahead and brand them at that point, 150 to 200 pounds. So branding 300-pound calves is not fun, but if you're, you know, dragging them, that's okay. You can, but you know, no younger than 150 pounds or a couple months, just because those guys tend to have more. You have to have a really good brander. Not to say you can't do it, but you gotta have someone pretty experienced to brand those really young calves. So hopefully that answered your question. Okay, so any more before we move on? Are we good? And we'll answer more. If you think of something, don't hesitate to chime in. I'm good with that. If you remember it at the end, that's fine too. Okay, we talked about that. And I'm going to preach the veterinarian contact again, particularly for sheep, simply due to the fact that sheep and goats, a lot of these, whenever you're, say, have 4-H animals, and the same is true with 4-H calves too, but they tend to be exposed to a lot of viruses and bacterial diseases that they may not be exposed to at the farm and ranch when you take them out to shows, and you want to be mindful of that. I know it, and they had to deal with it for a couple of years. You guys still might be dealing with it, I don't know, but sore mouth really went around the show circuit on the west side of the state. And you bring that back home, that's where you run into some issues. So where the veterinarian is helpful on the sheep side is he can, if something starts to crop up in your herd or in the surrounding areas, hopefully he or she can help kind of figure that out, and maybe you can intervene with a new vaccine that maybe you haven't typically used before. So just like with cattle, sheep and goats do the same thing. You're going to get a peak after their first, but really they do better with a second or a booster. And you can tighten this up a little bit, you know, on sheep for about 2 weeks in between time. So what do we vaccinate for on the small ruminant? Probably the most predominant one is enterotoxemia type C and D. They have products specific for sheep. However, like I said, if you're running both, you can use some of these 7-8-way products. They all contain this enterotoxemia protection, and you can use them both in your sheep and goat or cattle. The other thing that's probably good to have is tetanus in your program, but keep in mind that these, particularly tetanus, and I've personally had experience with this in cattle, they really don't offer the best protection until they get that booster, okay? So, we had an instance where we did an experiment on age of castration, actually, and we were castrating older calves with a bander, which FYI I'm not a fan of. And we hit them with tetanus at that time, right when we banded. And he ended up, we had a calf get tetanus. If you've ever experienced it, it's not a fun disease to see an animal go through. Even though he'd been technically vaccinated for it, it offered not near enough protection once he was exposed to the antigen. So anyway, so really the boosters offer the best protection on these. So something unique to sheep and goats is what's called Cassius Lymphadenitis. You can see here, this is where they get those abscesses on their face and their neck, and anywhere there's a lymph node on the surface, these things will abscess on you, and once they burst, they're just full of the virus, and they can pass it on to anything else they come in contact with. And so you really, if you're buying new animals, you want to make sure that there's no signs, even through scarring in areas, say you might be able to see an old scar of where a wound used to be. You really want to make sure that they're clear of that disease, or you're not bringing that to your herd. Something that kind of rears its ugly head occasionally, but in open country, not as problematic, is ovine progressive pneumonia. So just like with the cattle, there's a couple reproductive diseases that you want to protect your ewes and rams from. It's lepto and vibrio particular. Lepto can live in the water as well. So not a bad idea to go ahead and have this in your vaccination protocol for your sheep and your cattle too. Chlamydia, less of an issue on cattle, more of an issue in sheep and small family flocks. And Q fever is unique to small ruminants. I don't know if you're familiar with this. It can cause late-term abortions, but typically they'll shed the virus at lambing, and it's not so much problem for the lamb or the ewe as it is for you, meaning YOU. So it's highly contagious to humans, and it can make you fairly sick. So if you're handling new lambs, be sure and wear gloves of some kind. And then there's really, I don't believe there's a vaccine for that, but be aware of that. So the two diseases that are sort of unique for small ruminants are sore mouth, like I'd mentioned, and blue tongue. Cattle can obviously get blue tongue too, but most common in the small ruminants. They are in the hoof and mouth family. And so you do want to probably incorporate one of these or both in your vaccine program, if particularly you're going to be taking these animals to showing events, okay? So what's unique about the sore mouth vaccine is how you administer it. Not sure if anyone else has had exposure to this, but basically you find a bare patch, usually under the tail head, and you scrape, make it so it's raw, and then you administer the vaccine that way. It's kind of a lot like the TB test, right? It's kind of how I equate it. So read the directions before you're going to incorporate this product into your program, because you are going to have to handle them a little bit in order to do it. Scrapie disease is what's called a prion disease. And what a prion is, it's also a protein base that lives in the brain. It's in the mad cow family. It's in the chronic wasting family. And then basically what happens is it attacks the nervous system of the animal. And it's highly transmissible. This particular disease is highly transmissible between animals. It's not that they, anyway. So, and there's no real vaccine to prevent it, right? So how we manage this disease is through monitoring through the state veterinarian's office. And so a veterinarian does need to come out and collect tissue for the testing. And then if all's good, you're going to get what's called a scrapie tag. And this is for animals of breeding age and even wethers over 18 months that are going to cross state lines. And so that's just a requirement of the state. And really, it's pretty much a national program. Okay, so like I said, for sheep and goats, it's based a lot on their stage of production as to when you're going to do what. So you have about 45 days of a pre-breeding window, 60 for the actual breeding season, 90 pre-lambing. Okay, so that, what is it, 145 days of a gestation. And then 60 days to get them to weaning, and so on. So here is kind of a general calendar you can look to in terms of management. And I'm going to stop share here really quick, and then I'll copy the link into the chat box. But we have where'd you go? Oh no, I brought it up. Where'd it go? Let's see if I can find it this way. Really quick. Sorry, I'd had it up on the screen. Oh, there it is. Okay. Can you guys see the screen right now? Raise your hands, something.
Okay.
Okay. Can you see it says sheep and goat vaccine health management?
Yes.
Yep. Okay.
Yes.
So basically this is a paper you can download, and this is we published this a little over a year ago, and it really kind of goes through more specific information about health management in your sheep herds. So let me click on the link, and you can download it into something that's a little easier to maybe read in a PDF format. But I'll go ahead and put this in our chat so you can look that up for an added resource. Okay, moving on. My dogs are throwing a fit. Hopefully you can't hear them. Okay, so this is kind of a mimic of that same calendar that's in the paper, but basically there's a couple options if you're in more of, you have intense management, right? More of a family flock situation where it's recommended you put your hands on these guys like 5 times a year. In a ranch situation, that's not practical. And so we've tried to simplify that a little bit. But dams prior to lambing, you give them that 7-8 way product. And then at birth for those lambs, you can hit them with a vitamin E and selenium shot. Most people like to do this. The vitamin E and selenium combined really help boost immunity in these guys. They can be susceptible to selenium deficiencies as well. So this was just an added boost of that. You would control your parasites in your dams at that time. So 30 days in is when you would start your vaccination program for your lambs. And depending on the area, if you feel like you're at high risk for either CLA or sore mouth or one of these kind of unique diseases, go ahead and start that program. But for sure, include an enterotoxemia 7-8 way product for your lambs at that point. And then at weaning, again, you might want to go ahead and booster. I should have that in there. So they have a 2-dose boost before they leave your operation. So prior to breeding is when you want to do the reproductive vaccines, and then hit them again with a booster. And this is every year. Okay. So they do need the 2 shots annually, ideally, for your ewes and your rams, and then the clostridial at the end of your breeding season. Okay. A little vaccination. Now we're going to kind of wrap up with combining good management for all animals, and that is in regards to vaccination management. One of the things that I think happens, that's been my experience, is we'll have some ranches that notoriously have health issues. When I get, say, bulls, for example, at the station, it's very owner specific. It's not that they're not giving shots. I think where some things fall down sometimes is how the vaccine is managed, how the animals are managed, that kind of thing that affects how healthy these animals can be once they leave the ranch. So this, I'm sure a lot of you have been through BQA, have seen this slide, but the do's and don'ts, certainly on your vaccines, they're very sensitive to temperature swings. You want to keep them cold and consistent temperatures. I had a refrigerator in our trailer freeze, and so now I know those vaccines, even though they're cold, they're no good either. So avoid the full extremes. And then they do prefer dark, right? The light will cause them to deactivate a little bit. So you want to keep them in that cooler on those work days as best you can. Certainly read labels for dose, for what they're for. And then when you're doing these, you're giving Clostridial and a viral, a lot of times they look very similar in the syringe. So you want to label those syringes very clearly because sometimes the doses are different as well. Now, change needles frequently. This picture would indicate you need to change it after 2 uses because you've got a barb and it's dirty. But in reality, after you've emptied a gun, for example, a vaccine gun, that's a good time to change. Or if you're really having to force that needle in and you're dealing with a dirty, blunt object, those are the guys that get the vaccine blemishes that we really don't like to see because it can be a source of infection. So the higher the number, the lighter the gauge of the needle, meaning the thinner it is. And so on your vaccines, they're really very watery, right? They're not very thick. So a light gauge needle is ideal for vaccinations, and then maybe a little heavier gauge needle on your antibiotics. So for lambs and kids, they can go really light and really small on these 20 gauge because they have pretty thin skin. You want to do it under the skin, maybe 18 gauge for both cattle and sheep. Calves, you can also use an 18 gauge, but a little shorter needle. What you don't want to do is disinfect needles in between injections because then you kill your vaccine. So we don't want to do that. We had a family that they were fairly new to raising livestock and they really wanted to do things right. And they had all the vaccines they were supposed to give. And blackleg cropped up in their herd, which is unheard of, right? Well, as I got to quiz them, I was asking kind of how you vaccinated, and the lady was a nurse. And so she would dab or wet the area with an alcohol or disinfect something, kind of like they do when they give shots or used to. I don't even know if they do it to humans anymore. But basically what you do is they can kill at least a portion of that vaccine. And particularly with animals with hair, that's certainly the case. So the only time you really want to disinfect the needles in between animals when there's going to be a blood transfer, meaning implant guns. Those are the big, heavy 14 gauge needles. You're going to come in contact with blood at some point, and so you want to disinfect those. You don't want to mix medications or vaccines together thinking one shot will make a better shot, mixing two to one's better. The reality is you even want to place those vaccinations a good 3 inches apart from each other because they can interact to a negative extent, nullifying both vaccines. On the modified lives, like I mentioned, short shelf life. Once you mix it, you're kind of done for the day, even if you have half a bottle left. So partial those out so you don't have too much wasted. Okay, and we're all guilty of this. I'm even guilty of this. You get busy, you're in a hurry, and you leave the cooler door open. Try to avoid that. In terms of placement of vaccine, even in your little calves, you want to do that triangle right in the neck, below the ligament that holds their head up, above their jugular, and right in this sweet spot area. Okay, and try not to get the guy holding the calf at the time if you can avoid it. Sheep and goats, pretty similar. You kind of have this window here, but a lot of times we'll go up, if they're crammed up in an alley, which is okay, you can go up under the skin, up at the nape of the neck, as long as you are under the skin, which is subcutaneous, okay? So we have various ways of administering vaccines and drugs. Intranasal is becoming more and more popular, and there's I know they're working on more products that are intranasal for viral diseases. In the muscle, least desirable, right? Because we know that can cause damage. Intravenous is in the vein and the jugular. There are some products like Banamine, which is an anti-inflammatory that's required. You have to give it in the vein. And it is very reactive in the muscle. So if at all possible, you do want to go IV with that particular drug because it is very reactive in the muscle. Interperitoneal is rare. It's when you can't get a vein or they're very sick, dehydrated, and that's simply going in the gut. So follow, what the labels say. So here's just the examples of the different ways. So here's kind of a normal under the skin at the neck region. This is what's called interperitoneal. This is for probably a scoured lamb, needs some fluids. This is a very old picture, but it was the best one I could find. When you're doing an IV on a beef cow, you're gonna have to restrain them and pull their head to the side, ideally. With sheep, you can do it, if you just sit on them and move their head to the side. The angle of that vein is pretty straight from the eye, and so that's where you want to go. And in cattle, it's the size of a garden hose. And in sheep, it's not much smaller. It's still pretty easy to find. The challenge, if they're not shorn, is to be able to find it sometimes. So I show this little picture here because we're very excited. Once we can go face-to-face, folks, we're going to be able to do some hands-on stuff without actually putting hands on animals necessarily. We have earned a grant that is going to allow people to practice giving shots, doing IV, doing some things, even implanting and tubing calves, right? When they're born, if you need to get colostrum in them. So we're pretty excited about this kit that we'll be getting in and that hopefully we can bring to you in person someday for some trainings. So just in summary, I don't know how we're doing on time. We're over time. Okay, I'll talk fast. Immunity starts in utero with the dam being able to transfer some of that if she's well vaccinated. But really, they need that boost at birth through the colostrum. And how good that colostrum is can be heavily manipulated based on the dam's nutritional status. Okay. Modified lives, just start, if you haven't already, start looking to incorporate this into your branding vaccination program for your viral diseases, as it really does help set these calves up to have a very strong immune system. Okay. Boosters should be given at weaning, and that will just carry that immunity on up. And like I said, depending on your management program, you may need to do a third shot if you're going to keep those calves for, 45, 60 days after you actually pull them from mom. But there are some financial benefits to doing that. When you're handling animals, stress will induce the release of cortisol. Cortisol can reduce the animal's ability to absorb and utilize the vaccines you give. So be mindful of that prior to working any animal, that you're not over stressing them. Sheep are susceptible to diseases that cattle aren't, and vice versa. So their vaccine protocols are going to be slightly different. And that timing of that is slightly different too, because it's more closely tied to stage of production. All vaccines must be managed properly to be effective, right? This is where I think sometimes things fall down in the program if they get too hot, if they're out in the sun, if they're allowed to expire, or if they're used, like in a modified live, you throw them in the fridge and then use them the next day. These are some things that can cause some real problems. When you're selecting a vaccine, more so on those 7-8-way products, find the vaccine that has the smallest dosage, okay? So a lot of these 7-8 ways now offer a 2 milliliter dose, versus a 5. And so those are the products you really would like to search out, because the less drug that goes into these animals, the less chance of injection site blemishes. It doesn't make them less effective. It just means they're more concentrated. And as always, please, please, the best you can, consult with a veterinarian before establishing any vaccination protocol. And with that, I will take questions. I'm sorry I ran long. I didn't realize I was running that long.
Oh, that's fine. Marcy, I do have a question in regards to the Covaxin 8 vaccine. It is both for cattle and for sheep. Now, there's, you know, I guess some discussion about how much you give a sheep, because there's, you know, on the label it says for cattle and sheep 5 ml. Give 5 ml sub-Q, but there's also, you know, there was a workshop, anyhow, it was told for sheep to give half of the dosage, so 2.5 ml the first time, and then 2 weeks later the booster the other half, and so they would get 5 mLs.
Yep.
Okay, so that's true.
Yeah, so with that, yes, yes. Yeah, so to a certain extent, it is based on size of animal, right? So that's why on that particular product, the cattle get 5, where it's recommended for sheep. It's not labeled for goats, but a lot of goats get Covaxin. For 2.5, 2 to 2.5, right? And on the products that I think it's the Vision 7, that is a 2 ml product, it's the same for both cattle and sheep. So, like I said, it is a little more concentrated, but in that case, they don't break it out between sheep and cattle. So just, read the labels, and that's correct on the Covaxin. It's different for sheep versus cattle. There's a question here in the chat.
Okay, I just wanted to
At
verify.
NMSU, is there? Yeah,
I'm sorry.
Yeah,
I just wanted
sure.
to verify it, because on there you read it and you're like, okay, 5 mLs today, 2 weeks later, 5 mLs for sheep. But I just wanted the producers to know it's half and half. Okay.
Yeah, no, it's half that. Yeah. So at NMSU, is there a vet that anyone can consult with? Yes. So John Wenzel is our extension veterinarian, and he tends to be fairly happy to answer questions in that regard. I was just with him yesterday, actually, and he was we were doing a program in Silver City and talking about vaccinating cows. And he had some very interesting comments on that. So, John Wenzel is our extension vet that can maybe help you. Will an abscess on a cow's face infect others? Okay, so no. So that's the difference between sheep and cattle in some regard. Now, in some cases, sheep will just get an abscess. They'll get a tooth abscess, right? And it's not going to affect other sheep, but because that disease exists, the CLA exists in sheep, you might see if it's starting to crop up in other sheep, that tells you you're dealing with the virus. But when you have one on cattle, that's usually just like and I hate jaw abscesses, they're really hard to fix, but if it's soft and you can bring them in and you can lance it and flush it with iodine, you're good. It's not going to affect other cattle. It's just she ate something with a thorn in it. Who knows what they do, but that can happen. But they're not susceptible to CLA like sheep and goats are.
Okay. One more question. You know, the vaccination schedule is, you know, around the gestation cycle, and sheep, you know, if you have a progressed
you know, if you're breeding your sheep twice a year, are you going to need to vaccinate your sheep twice a year to the gestation cycles?
No. So the mature ewes that have gotten their full booster dose, then you can go into that annual mode, right? Regardless of your breeding program. So if you're breeding twice a year, intensive breeding program, as long as they're getting it at a consistent time. The only ones that I would maybe think about boostering more than once a year is the reproductive, the leptovibrio, simply because they're going through 2 breeding seasons. But in terms of the bacterial diseases and respiratory diseases, they should only need that once a year booster.
Okay, great. Thank you, Marcy. Did we have any other questions?
Yes, hello. I had a question.
Okay, go ahead.
Yes, doctor. Doctor, that vaccinate in the sheep. I usually I prefer to give them a shot under the arm, like in the armpit. But I've noticed sometimes I see these abscesses or bubbles, and I don't know if I'm not going deep enough, or I don't know if the vaccine is being effective, I guess.
So I have bad news, because it's true for the sheep, goats, and cattle. All they have got a lymph node right there, and they don't have a lot of blood, like blood vessels. So yeah, your risk for an abscess is a little higher in the armpit, but it's also, they don't absorb the product that well. So it's ideal if you can go ahead and get them up in the neck, somehow under the skin, or in the brisket area. That works too. It just right in that air pit, there's just not a lot of blood vessels for the body to pick up the vaccine. So that's why we recommend really to kind of stick with the head if you can.
Okay, well, thank you for answering that. It makes a lot of sense. I'll change it from here on out.
Yep. Okay. Using 840 button tags for tracing diseases. Well, Stuart, we don't know. That's the collective answer. So disease traceability in our country has been an ongoing issue. Started back in the early 2000s. The US government was trying to issue what are called RFID tags. And the idea was they wanted a premise ID, and then you put your tags in, which you paid for, and then we know where every cow is everywhere all the time. And they got a lot of industry pushback, so it kind of went away. And then it crept back into the picture, I don't know, about 3 years ago or so. And there was some talk of any breeding animals. The first group of animals affected by this would be any breeding animals crossing state lines, would have to have an 840 tag, premise ID, and the like. And then they were going to phase in all other cattle. To my knowledge, that has still been on hold because logistics of the government can't figure it out. However, there is an independent company if you're wanting to kind of tackle this yourself, to protect yourself. It's a private company. It's called US Cattle Trace out of Kansas. And this is a producer-based program that you can, you still have to buy the tags. They are still USDA 840 tags, but it's managed through this private company. But right now it's not mandated through USDA, to my knowledge, on the calves. So I don't know if I answered your question. It's a moving target, so it's hard to keep up with what is current and what the rules are, because it seems like they're constantly changing.
Marcy, I have a question. This is so we are going to have lambs pretty soon, and from the past years that we had baby lambs, we sometimes have like a good 2 to 3 lambs that end up with their lower eyelid kind of rolled in, and we don't know really how that happens or how to treat it. So maybe if you could really touch base on that, I would really appreciate it.
Okay, so inverted eyelids are not uncommon, unfortunately, and you can look back at your records maybe if it's out of the same dam. This is a genetic problem, okay? It's not really nutrition, it's not viral, nothing. It's a genetic thing that she passes on. It could be a RAM situation, but it sounds like if it's just a few, it's likely on the dam side that's doing this. You can fix it. And I'm trying to think if they clip the lid, I don't know. I'm not an eyeball person. I really don't, but I'm trying to think if I have a presentation where I talk about some genetic issues that sheep can face, and that inverted eyelid is one. But so might check your records, see if it seems to be out of the same dams or daughters of dams that have had the problem in the past, because that's likely what's going on.
Yeah, one of our ewes, she had some couple of babies. We had some couple of babies from her, and either like one of her twins would end up having that issue every year. So like you've mentioned, it might be coming from genetics. But thank you though.
You bet.
Okay, thank you, Mikal. Okay, if nobody has any other questions, we'll go ahead and move on. And I wanted to show a few slides, if you don't mind, Marcy. Thank you again for your presentation. It's very informative as always, but we will be contacting you soon for more presentations. I'd like to invite everybody to next week. We're going to switch gears and we're going to move on to garden planning and seed selection. So go ahead and join us. It's going to be 5:30, 6:30. The Zoom information is there. And then we also have it posted on our Facebook page, and then also on our webpage. We have our webpage up and going. It's nsaproject.nmsu.edu. We also have a YouTube channel. All of our webinars are recorded and posted on there. And then if you would like to be part of our monthly newsletter, we send out, go ahead and email us there, nsaproject@nmsu.edu. And we also have a vacant position. We are looking for a horticulture field assistant. So get at us for more information on that. And then please, before you guys leave, a survey will pop up after you exit. Fill it out for us and let us know how the webinar was tonight. And then also if you have some suggestions on future webinars, we are very much open to it. So that's what I wanted to cover. And again, thank you for attending tonight and putting time aside tonight to attend. So with that, I'll go ahead and end it. And thank you again. Enjoy you guys' evening.
The NSA project is a cooperative extension service initiative delivered in collaboration with the Diné College Land Grant Office, and then also with the Community Outreach and Patient Empowerment Program. The project is funded by USDA's Outreach and Assistance for Socially Disadvantaged Farmers and Ranchers and Veteran Farmers and Ranchers program. The NSA project field staff consists of myself and then also our field specialist, Kelly Lantana. Okay, so we have 3 goals that we are going to accomplish. And number 1, as you can see on the screen, is to improve the operations and profitability and sustainability of socially disadvantaged Navajo farmers and ranchers and veteran farmers and ranchers. We are also increasing our Navajo farmers and ranchers and veteran farmers and ranchers knowledge and use of USDA programs such as NRCS, FSA, rural development and risk management agency programs and services, and other resource providers such as BIA and NDA, the list goes on. And then lastly, we would like to increase the local production and consumption of fresh fruits and vegetables. All right, hold on. And healthy food by Navajo families and individuals.